Welcome. Assalamu alaikum. I am Dr. Zeeshan Wani. I am basically a gastroenterologist and hepatologist. I have been previously an associate professor in country's leading institute, ILBS, Institute of Liver and Biliary Science, New Delhi. And presently I am associate professor in super specialty hospital, GMC Srinagar, in the Department of Gastroenterology. And it's a very good thing in our country that apart from the government institutes, the private sectors are also growing. They are very mature private centers and advanced private centers in metropolitan cities and big cities of India. And we always wish that apart from government institutes and teaching institutes, the private sector should also grow in the states like J&K and all other economically lower types of states. So Government of India and Health Ministry of India also wants that not only the teaching institutes in government, but the teaching institutes and hospitals should also grow concurrently in private institutes. And with this, I welcome that Sheikh-ul-Alam hospital has been started in Srinagar, Karanagar, and it is a super specialty hospital, and I hope that all facilities in all departments of super specialty will be developed, which have been already developed, and more work will be done to improve the super specialty care in Sheikh-ul-Alam hospital. I have also started my private practice in super specialty hospital Sheikh-ul-Alam in evening hours, because I am in the teaching department, actually a associate professor in government, so I can only serve people after evening hours, or maybe in holidays after completing my work in my teaching institute, which is my prime responsibility. But apart, we will try to help these institutes in Srinagar city in our evening hours and try to grow other people also, so that the best type of patient care will be given, as per the government, guidelines. So I congratulate the Sheikh-ul-Alam people to start this new super specialty hospital in Srinagar, Karanagar, and I give my message to my all patients that I have also started my private practice, my clinics in evening hours as per government, strictly as per government orders, which are applicable to me. I have always honored to the government orders, and I will be available in evening hours in this institute, giving you the best type of patient care in gastroenterology field and interventional gastroenterology, like basic endoscopies, polypectomies, colonoscopies, ERSP, and advanced EUS, endo-ultrasound, which I am doing. I am the pioneer of endo-ultrasound in Valley, and I have started endoscopic ultrasound in J&K. I'm the first person to come here from last 10 years. I have been teaching in my institute also, and we are planning to start endo-ultrasound and ERSP and all other difficult procedures in this institute also. But our prime importance is always our teaching institute in government, and whatever spare time in evening we have, we will try to help these institutes also to grow fast for the benefit of patients.
Thank you so much, sir.
Okay, sir. Thank you, sir. Okay. So the best thing is that I would say that homemade diet is the prime importance. Then in diet, the fiber should be liberally allowed. That's one. Second, protein and carbohydrate and lipid, that is fat, this should be balanced. We should give our nutritionists and our basic science students and teachers should give a very clear education at school level, that what is a balanced diet in terms of proteins, fats, and carbohydrates. Then second is adding the fiber diet. Third is adding the antioxidant based diet, that is fruits and other antioxidants. And more important is exercise. If you don't have a physical exercise, your gut is always inertic. you will have all the functional bowel disorders. Functional bowel disorders are disorders which are not actually a disease, but still patient is taking a lot of drugs, going to the hospitals. The quality of life is gone in these. If they have their life is stressless and they are exercising, they have a planned exercising, schedule, and then their diet is natural and homemade, fiber rich, protein rich, then it's excellent. Because current era we don't have a concept of a balanced diet. Then the fast foods outside, then lack of exercise, keeping your children with mobiles and on net and other things. I don't think that we are producing Newtons and Einsteins by excessive use of mobiles. We are not producing big scientists by excessive use of internet and communicative media like mobiles. And our children, which were quite healthy in past, now they are almost 30 to 40% of our young children are suffering from anxiety disorders. Our hospitals are flooded with the anxiety issues of children. And I think the role is that they are giving excessive sedentary life. Second, life to the mobiles and internet. The parents feel that by using mobiles they will become Einstein. It's not that. It is the liberty in the nature, roaming around in the nature, physical exercise which makes your brain also good. It is you learn always from nature. So if you don't interact with nature, you cannot be Einstein or Newton. So my advice to parents is minimize the mobile use. Even government should make a law. They should pass a law. Seeing the 40% children are suffering from anxiety and depression disorders, government should pass a strict law so that the parents can apply this, legally on their children, that how much, this communicative media can be used. Then how much exercise and natural interaction is to be given to a child. Then he can prove to be a good mathematician, physicist, a scientist or a doctor or an engineer. Otherwise, I personally, they are becoming obese, they have anxiety issues, and then they have metabolic issues like fatty liver and gut disturbances. Because in J&K, especially in Kashmir, the types of cancers are, not only growing in terms of different types of cancers. Second is their number is also increasing potentially. We are matching in cancer, prevalence and incidence to the best of the world. That means if suppose pancreatic cancer is highest in Europe, we are also having a lot of pancreatic cancers. If, for example, gallbladder malignancy is very high in Europe as well as in the Ganges area of India, people living around Ganga, Ganges area, we are also having gallbladder malignancies at peak. We have already highest CA stomachs and CA esophagus matching the Mediterranean areas, Iran and other things. Then colonic cancers are very high in Europe and West. We are matching in colonic cancers to Europe and West. That means we are top in every cancer in terms of prevalence and incidence, matching the world best in terms of prevalence and incidence area wise. The reason being that one is that our diet is not good. Second is lack of exercise. I am telling you, lack of exercise and diet. Third is a scientific that our genes are getting mutated. That means there is a genetic anticipation of genes. The genes which were suppressed 60 years back, now they are opening up, anticipated. They are getting anticipated. And now these malignancies are opening up for our, and the phenotype, that is environmental factors are also playing, that we don't know what diet we are taking, how much chemical load is in the diet, and how much exercise we should do. See, older people here were exercising, they were taking less food, the malignancies were less. Although their malignancies were high in those people who were smoking, the smokers we have seen had a lot of, gut malignancies. But nowadays we not only smoke, we have added factors, that is obesity. Then we have added factors, that is chemical based, bazari food. So these factors are trying to anticipate our genes. Genes are there. It's not that. But we could have suppressed these genes for, say another 60 years. But due to obesity, due to lack of exercise, due to diet, and due to another, bad habits like smoking and other things, these types of cancers have overwhelmingly come out. But we need to further investigate that why our genes are mutating fast. That is a research question. There are factors we can see apparently, but there are some other hidden factors for which a proper research needs to be taken out.
तो हॉस्पिटल के बारे में जानना चाहें किस तरह की सुविधा यहाँ पे
I think they have started